I'm Dr. Campbell with Vet Candy Watch. This show is sponsored by Centrix Animal Care, makers of Ocunovus BioEnhance Gel Eye Drops. I'm Dr. Campbell with Vet Candy Watch. The eyes may be a window to a dog's soul, but the eyelids may be a window to their evolution. Dogs' eyes have evolved to appeal to humans. Researchers at the University of Portsmouth have concluded that dogs have evolved muscles around their eyes which allow them to make expressions that particularly appeal to humans. Researchers both compared the facial anatomy of dogs and wolves to better understand the origins of the eyebrow lift. They also conducted behavioral studies of wolves at wildlife parks and at dogs at rescue shelters in Germany and the United Kingdom. And what their findings revealed is that certain dog breeds, including the Chihuahua, Labrador, Bloodhound, German Shepherd, Siberian Husky, and mixed breeds, all had a small specialized muscle called the levi anguli oculi medialis, which they used to produce their wide-eyed, seemingly innocent stare. In 4 wolves that were recently looked at, the muscles did not exist except for a few fibers. Researchers also found another muscle called the retractor anguli oculi lateralis, which pulls the eyelids towards the ears and contributes to that puppy dog eye expression. That muscle was well developed in all dogs except the husky, which is a breed with an ancient lineage. That muscle was also less prevalent in wolves. Recent studies have shown that canine expressions can appeal to humans, but this research from the UK and the US shows that there's an anatomical change around the eyes to make it all possible. These expressive eyebrows, as researchers call them, create the illusion of human-like communication, which seems to elicit a strong desire in humans to look after them. The muscle movement allows dogs' eyes to appear larger, more infant-like, and it also resembles a movement humans produce when they're sad. They theorize that dogs with this trait had an evolutionary advantage because humans' unconscious preference to protect those who had this appealing trait. While some may look and just see cuteness, those facial expressions may have been the evolutionary spark that set the beauty of the human-animal bond in motion. A new treatment may help treat a painful eye disease without the need for surgery. Dogs with entropion have a new option for treatment. Entropion, or inversion of the eyelid margin, is a common condition in both dogs and cats. It usually results in ingrowth of the eyelashes, known as trichiasis, and irritation of the globe by hair around the eyes. The disease is very irritating to the eyes of dogs and cats, and it's usually classified into primary, secondary, spastic, and cicatricial causes. Essentially, this condition can arise from genetics, old age, inflammation, or it can occur after a previous eye surgery. Left untreated, this condition can cause corneal edema, keratitis, or even loss of vision. Surgical correction has been reported as the only definitive treatment option for entropion. Well, there may be a new cause for hope. A new study indicates that fillers under the skin may be effective. Hyaluronic acid was injected as a subdermal filler about 1 to 2 millimeters from the eyelid margin until normal eyelid conformation was achieved. None of the patients needed sedation or general anesthesia. Among the 40 dogs and cats that were studied, 37 of them had complete resolution of the entropion, but they also had resolution of secondary signs like corneal ulceration, excessive tearing, and squinting. 3 of those in the study ended up needing permanent surgical correction, and no patients in the study had any complications. So, hyaluronic acid as a subdermal filler appears to be a safe, easy, and reliable method for a mild to moderate eyelid entropion. Although the pet parents of Chinese pugs, Shih Tzus, Chows, Shar-Peis, and other breeds are now hopeful that this technique can be employed as a non-surgical treatment, it's important to consult with your dog's veterinarian or veterinary ophthalmologist to determine if they're a candidate for this surgery. And now for some great tips.
Hey, DJ Heusler here at the Animal Eye Institute. Wanted to share a case with you guys today. Today is a 15-year-old cat named Sienna, a domestic short hair that had eardrum surgery and ear polyps removed a few years ago. She subsequently suffered a complication and developed a facial nerve paralysis. So she's unable to blink her eyelids. Her cornea has dried out, has developed a corneal ulcer, and she's been unable to heal over the last couple months. We've treated her with antibiotics, we've done some debridements with Q-tips, and she just won't heal. So time to think a little bit outside the box on this one.
So we're going to create our keratectomy here with the 64 beaver blade. And we're going to remove this diseased surface of the cornea, this diseased epithelium, down into fresh corneal stroma. So we're going to remove this section here. Now we're going to create our graft, our CCT, by dissecting this about 50% of the way through the cornea, freeing this up there. We'll make our incision into our conjunctiva in order to allow us to then cut the limbus to free this entire graft up, have some movement out of the graft so that we can lay this into our ulcer bed there. So we're going to use ADOT Vicryl and attach 2 sutures at each corner for some cardinal sutures there, and that will allow this graft to hold in place while we go back and suture the entire graft onto the cornea. So again, ADOT suture, we're going to start here at the limbus, go through the conjunctiva and into the cornea. We're going to tie that down. This is going to be a simple continuous pattern all the way around this graft. This suture will stay in the cornea for about 6 to 8 weeks while it dissolves on its own. We're going to come all the way around this graft here, suture it down. Now that we've got this all sutured down, we're going to tie it down, remove our tags. Now we're going to perform a temporary tarsorrhaphy, closing off about
a new twist to a common drug helps eye injuries heal faster. A topical cross-linked hyaluronic acid hydrogel revs up the healing process for corneal scratches and ulcers. When it comes to corneal injuries, any treatment that will help healing may be a help to all species. Superficial and deep corneal defects, meaning both epithelial and stromal defects, happen commonly in animals, including dogs, cats, and yes, humans. In fact, according to the World Health Organization, corneal opacities, including corneal ulceration, are the 4th leading cause of blindness in humans worldwide. Similarly, for dogs and cats, corneal ulcers can occur from trauma, and if left untreated, some injuries will lead to blindness. Although some superficial corneal lesions can heal quickly, deeper lesions can be particularly dangerous because if they're slow to heal, the lesion can perforate and dogs and cats can lose their sight. Hyaluronic acid has long been recognized as a topical treatment that will enhance corneal healing, but it doesn't last on the eye for very long. This study from the University of Cambridge tested the novel formulation of the hyaluronic acid gel in the eyes of 30 dogs and 30 cats. Some had acute corneal ulcers and others had persistent non-healing corneal ulcers. They treated them until the ulcers had healed. The results showed that the novel cross-link formulation helped both the acute corneal ulcers and the non-healing corneal ulcers heal faster compared to a non-cross-linked hyaluronic acid solution. Essentially, the cross-linked hyaluronic acid helped the ulcers heal faster. This research not only benefits companion animals like dogs and cats, but these results are encouraging for human eye injuries as well. Thanks for watching this episode of Vet Candy. I'm Dr. Courtney, the host of Vet Candy. If you want to stay up to date with the latest episodes and videos from Vet Candy, follow us on myvetcandy.com, Vet Candy on YouTube, and at myvetcandy on social media.